This doesn't mean peace, it means take two. Hey, it's Gord. It's Wednesday. I'm awake early. I have a couple of doctor's appointments this morning and an appointment with the courts. Yeah, as I promised you guys, I may I may get down a bit. That's just the cycles of my life, but I always face a challenge as a challenge, and I have come close to losing, but I've never lost because you don't lose if you keep trying. It's not a loss. So, so I'm going to go today, go see my doctor, get a couple of tests done, try and find out if there's some other ways, non-pharmaceutical, to medicate in between times of non-medication. I don't know how to say it. I don't want to go back on pharmaceuticals. I was talking with my buddy yesterday, and she told me, don't you dare go back to pharmaceuticals. And I'll tell you what I mean. A good example is right now, I don't feel too bad. If I were to and I'm about to, take a little medicine with you, that's going to get my day going. In fact, I'm going to do it on purpose so that by the time I go to my doctor, who is not my marijuana doctor, but my general practitioner, he can see me. The last time he saw me, I purposely did not medicate. And this time I will purposely medicate so that he can see the difference of the same guy in two states of mind and body. But at the same point, the issue that I am having, and thank you, MMJ, you always look after your people really well. The issue is somewhat buffered for a while, thanks to them, is that at times of extreme financial situation, like me having all my checks garnished and just no income, excuse me, at times like that, I should have had that too. It's at times like that that the mind, the subconscious, is constantly looking at, oh my goodness, how many days to go before there's no medicine left and full pain. Or, as I have been doing, which has been wrong, trying not to take it until you're in so much pain and then taking it to buffer it a little bit so that it will last. When we start doing that to ourselves, we're developing a snowball that just keeps getting bigger and bigger and bigger because you're not getting ahead of your pain. You're letting the pain get ahead of you, the snowball. You're chasing a snowball. It's a ridiculous way to medicate, and that is no fault of the doctor, and it's no fault of the medication. It's the fault of the current system we're in. Cannabis is cheaper than the other 5 pharmaceuticals I was on. Much cheaper. About 1/4. You take those 5 pharmaceuticals together, and I'm at least a quarter the price of those. Maybe even less. But with the pharmaceuticals, 85% of that was paid for by my health care. I paid 15%. I think there was one prescription I paid 20% for. With cannabis, I pay 100%. And I'm taxed on it. You're not taxed on the pharmaceuticals. So every single month is a struggle as to how do you pay for and maintain a proper medicine supply. And then the few times that you do reach out and ask, you have somebody like your ex-wife who says, if you wanted to survive better, why don't you spend less money on drugs? Medicine. We don't cut our medicine down when we're broke. You still need your medicine or you don't survive. But, and also to the one person who made that comment, putting me down for asking for money. Hervé Cote. I blocked you. I don't know if you're seeing this, but I blocked you. You know what? If you don't like me asking for assistance, I'm not asking for money. I'm asking for assistance. Some people already came forward yesterday with ways to help me that will save me $300 or $400 this month alone. But I'm helping them too at the same time, a barter thing. That's why I put these feelers out there. Not to be insulted by somebody who says, I have a worse thing. I lived through cancer and I never begged once. I'm not begging. I'm not begging. I'm asking. And I don't take offense by your offense of my request for assistance. I just feel sorry for you. That's the third time you've gotten an argument in my comments. That's the third time that you've been rather rude, and it will be the last time. Okay, a little bit of Sweet Island Scotch. No, Super Lemon Haze. Cheers. A few might wonder, if I'm talking about anxiety, why am I having a sativa? Well, first of all, when I go to the doctor's in another hour or so, I need the energy. Sativa will give it. If I go and take indica right now, I'm going to be really tired and maybe a little down when I get to them. I need the energy, even if it will provide some anxiety. But also the anxiety that I had for the last week, the anxiety that I've had for over a week has dipped. Why? Because I solved, through the partnership I have with friends out there, you guys, I solved some of the problem through yesterday's video. A couple of phone calls, boom. I'm at least okay for a week or so. We take things step by step. Do I always ask for money? No. And in fact, I can't stand putting my GoFundMe out there. But I found that it is a tool that some of you enjoy using to help me. I enjoy the help. But you try every port in a storm. Every port in a storm. I've never believed in charity, but I've never asked for charity. I really ask people, you want something of me? I'll give something back. Buy one of my pictures. Do nothing, just wish me well. But put me down, well, then you have something deep-seated inside yourself, not me. So I'm going to have the best day that I can possibly have. I'm working towards finding a way to reduce the garnishee. That's why I'm going to court today. And to reduce my pain, that's why I'm going to the doctor today. So I don't sit at home and just do nothing. I do my best to try to rearrange this life into one that I can live while still delivering whatever I can to you all. I really enjoy this channel. I love this channel. I love all of you. Peace and cheers. Love and harmony. See you next time.